Hello, everyone. This is Gregory Brass. I'm a PPRO for the Cree Board of Health and Social Services of James Bay. I'm calling in from Ariana. Yeah. Calling you in from the Cree Nation of Mistissini, which is part of the EUHC's James Bay Cree territory. And I'm actually not Cree myself. I'm a Ojibwe from another nation. So I'm living here on borrowed time, as you might say. I wanted to introduce you to our panelists for today on the COVID-19 response for the Access Open Minds projects. We have Peggy Day, who's the Aftercare Coordinator for Health and Wellness Division, Nuvialet Regional Corporation. Haley Gould, who's the Research Assistant Intake Worker for Access Open Minds in Mistissini, and Clifford Ballantyne, who's the Youth Worker for Access Open Minds in Sturgeon Lake First Nation. I'll be moderating the session, and we'll be taking questions. And at the end, I will discuss some of the questions. You can also do a live chat of some of your questions, and some of the panelists might be answering those as we go. So I guess we wanted to start with which one is going to go first, Peggy or Haley?
I can go first. I will start off with, I'm coming to you from Mistissini, and we acknowledge that we are in Mi'kmaq, the ancestral and unceded territory of the Mi'kmaq, and go ahead, Peg.
Somebody's going to do the land acknowledgement for Access.
Kat, do you want to start?
Yeah, sure. I'm Kat, and I am from the central office at in Montreal. And although I'm not a panelist myself, sorry, I'm just having some tech issues here. Although I'm not a panelist myself, I am working behind the scenes to plan these webinars, and we're located in Montreal. So we wanted to acknowledge that we live, work, and play on unceded Indigenous lands. The Pimuhteheu Nation is recognized as the custodians of these lands and waters. Jojage, commonly known as Montreal, is historically known as a gathering place for many First Nations, and today it's home to a diverse population of Indigenous and other peoples. We respect the continued connections with the past, present, and future, and ongoing relationships with Indigenous and other peoples within the community, the Montreal community. So thank you, and I'll pass it over to Alyssa.
Thanks, Kat. And I also am not a panelist today, but I work also with Kat behind the scenes, and I'm based in Halifax or Pimuhteheu in Mi'kmaq in Nova Scotia, the traditional and unceded territory of the Mi'kmaq people. Settlers and the Mi'kmaq people have lived in this territory under the provisions of the Peace and Friendship Treaties since 1760 and 1772. We are all treaty people in Mi'kmaq. So I'm gonna pass it back to the panelists, and Kat and I are gonna go offline. Thank you, Greg.
Thank you. So I guess it was, which one of you wanted to go first, Peggy or Haley?
Peggy?
Hi.
Okay.
Yeah.
You got the floor.
Okay, yeah, I'm not sure. I just want to say that I'm from the Inuvialuit. I'm Inuvialuit. I work with the Inuvialuit Regional Corporation to do our on the land programs as the Aftercare Coordinator. And with the COVID, it threw us for a loop because we're community oriented and we do all kinds of programs at the community. So it was a challenge, but we're resilient. We're good. I think we're doing an okay job. A lot of going out on the land. We had so many requests for on the land that we did quite a bit of funding for on the land. And the feedback we got was amazing. Some of them were saying they've never been out on the land because they never had a chance to, because they were busy working and couldn't get out for the spring hunt. So a lot of our elders and youth and everybody else got involved, and it was good. And welcome to the Inuvialuit.
Awesome. Thanks, Peg. I guess I'll go. For us here in Eskizoni, we were definitely thrown for a loop as well. And our ultimate goal was to try to maintain community and stay connected, and I guess B, try to stay connected with our clients and our patients. So we worked really hard to try to maintain kind of consistent services through telehealth. We had to do a lot of workarounds and come together through Zoom meetings and alternate kind of platforms to be successful. So yeah, we definitely felt like we got a lot of support from our banding council. We got a lot of support from our directors and leaders, but it definitely was something that A, we weren't really prepared for, and B, who would have ever thought that we would be dealing with this right now? So, yeah, that's basically it.
It's one of the tricky parts about calling in is you have to remember that you muted yourself. Cliff, what do you want to say about the impact of the COVID-19 on Sturgeon Lake?
Yeah, I'm Clifford Ballantyne, coming out from Sturgeon Lake First Nation. We're Plain Tree people, and yeah, it has kind of hit us hard in terms of how do we now react to what's happening, because a lot of like what we're doing is like a lot of connection, a lot of being in the same space, so it's kind of made things really challenging that we kind of had to shut down our youth space for a while. And we're kind of at the point where now we're starting to slowly open up the youth space, but then and I think a lot of ways we're going back to more of how when we first started Access is where we would go do a lot of outings with youth and getting to know them, creating a lot of rapport. So I think in this way, it's kind of a nice way that we're kind of doing things, or it's kind of a familiar way of how we used to do things in the beginning. So now we're focusing on more outdoor events like sports and some other different like culture-based stuff, some canoeing. So that's kind of where we're at right now with it.
Yeah, it's been a similar situation for Mistissini Cree Nation here. We basically shut down all of our, we don't have any in-person visits anymore. We just have all virtual sessions, and all the activities for the youth have shut down as well for the youth center. It's been very, very difficult. I'm not going to sugarcoat it. So I think this situation has thrown everyone for a loop. So it's both distressing to hear what we're all going through, but at the same time, you take some comfort that we're not the only ones who are feeling the impacts. But things are slowly starting to come back to normal, or some kind of normality, and moving forward. But in our situation, we haven't had any cases or outbreaks in our region, so I think that's the main thing, is that we've managed to keep people safe, and that's probably the most important part. Does anyone else want to have any additional comments here?
Well, I guess in Eskizoni, like, yeah, our youth space shut down as well, and basically the community basically shut down in totality, and we just did our best. And I appreciate you saying that you're not sugarcoating it, because it was really hard, and it still is hard, especially when it comes to things around funding and getting access to some of those especially funds for our employees that were based off of like own source revenue and things like that we just didn't have access to now. because of COVID. So I just want to say I appreciate you saying that, because it has been difficult.
Yeah. One of the things I've heard too is in all the discussion here so far is people making use of some land-based opportunities to do programming with kids. We've done a little bit of that. So it happens sort of naturally in our region, because every spring the trees go off for goose break. And so usually the families will disappear for about 3 weeks to do their annual goose hunt. And that's worked pretty well. Unfortunately, it doesn't benefit everyone because not everyone has access to a camp. But you know, some families are able to head off to the camps. But it's a little different now that everyone's back from the camps, and so, you know, some of the kind of social challenges that happened in previous summers are happening again. So, and it's exacerbated. So, yeah, no, it's still a very difficult time. I don't know what your situations are like as well.
Within
kind of a
the
seasonality to the distress, I would say.
Within the IRC, we had the on the land program for starting in March, and we did it until the end of April. And we had 2 phases where they can sign up for funding for gas and groceries to go out 2 weeks at a time, because we were encouraging the isolation. That's just when we had 1 case here in Inuvik in the Beaufort Delta, and so people were quite scared because it's so unknown, and everybody was just ready to go out on the land. I called one of the coastal communities and see how everything was going. And they said it was like a ghost town in the community. Everybody was out on the land fishing. So yeah, it was good. In the end, it turned out okay because there was a lot of family time.
Okay. What about the other panelists? How has your service or community had to adapt? Like, what are some of the strategies you used?
For us here in Eskazoni, switching over to telehealth appointments was a struggle because not everyone has access to reliable kind of internet and reliable phone services. So we've had to kind of adapt to be able to meet the needs of our community members through like offering like daily deliveries of groceries and pharmaceuticals and things like that. So we've just had to, everybody has had to be on board and just willing to change and adapt quickly, because every day it was something different. Like one day the parameters would be this, and then the precautions would change the next day. So we unfortunately, like I said, we didn't have any youth-based programming, but we were able to kind of turn that into online programming. So our youth group got online and would set up activities and things like that to maintain that connection with our youth. And like Peggy said, we had a lot more family time, which I think a lot of people appreciated, especially a lot of the kids when they would talk about, oh, I don't have to go to school. So there was a lot of that too. So yeah, just being able to be flexible and adapt.
Okay. Les, what strategies has Sturgeon Lake used to adapt?
Yeah, so they did have their pandemic plan that they actually finished a few years back. So that's actually been going pretty good. I think in terms of receiving services, we'd already done things where we would meet the client at their place, and then they would be in the vehicle and they would be able to do counseling that way. So that hasn't changed much. It's just when they want to receive counseling, that's been a little bit more tricky. Like, we do have the phone, but we don't have anything in terms of like virtual care or anything like that. So, and then youth that identify with, like, because normally we would get our referrals from the school or the youth that would come to the youth space. But since none of that is happening right now, we've kind of seen a little bit of a decrease in, getting new people being referred to counseling but I think for the most part, they have been receiving a lot of care in terms of, you know, making sure that their mental health is okay. So, but yeah, that's kind of where we're at with it. But just the engagement part, because of our work really does focus on a lot of like authentic youth engagement, it's just been hard to kind of figure out ways to actually engage the youth while also, you know, practicing the whole social distance.
Yeah, it's a similar experience with us. It's what we've done as a public health department is we've engaged the population as a whole in different contests, physical activity, you know, art projects, stuff like that. And that's worked fairly well, but there's only so much you can do of that. So really just trying to encourage people to stay active, get outside. I think in the initial part of the pandemic, a lot of people were had this idea that they couldn't even step outside of the house because the sort of virus was everywhere. And that certainly wasn't the case. But the other observation I think I could share is that there's kind of phases in our area in terms of the reaction. Is that first there was a lot of uncertainty and even a bit of denial and people not taking this seriously, and then we started seeing what was happening in Europe, and now especially in the United States, you know, the kind of reality has hit that this thing is a very serious issue and we need to address it. And then a certain level of confidence over time, as you know, we've seen that we've been able to flatten the curve. But at this stage, I think there's kind of a bit of exhaustion that's kind of wearing in and people wanting to get back to normal. Just this morning, we had a monthly check-in with all our therapists and staff associated with the project to find out how they're feeling, how they're doing, and how the virtual therapy sessions are going. And they go fairly well. Clients are starting to come back, but then at the same time, there's some clients who say, well, you know, I'm going to wait till I can go back to face-to-face meetings with you, then I'll see you again. And then they realize, well, actually, that's not going to happen for a couple more months. So there's still a lot of adjustment going through, but like I said, I think there are phases to this situation, and so none of us really know what to expect, so we just have to keep adapting and keep adapting. So that's how things are going for us anyways. Does anyone have any other comments they want to add? Peggy, you want to say anything more about your community's adaptive strategy?
Yeah, we've during March and April, it's our time that they always have all of the jamborees in the communities. It's they have every weekend in each of the Beaufort communities. There's they have skidoo racing, singing, talent shows, like on the land activity contests like axe throwing and harpoon throwing, and it's just a really good fun weekend in each of the communities host. So this year they did it virtual. They had contests for the talent shows for each of the age categories, the jigging, they had that as well. And through IRC, they had the darkest tan. So, because everybody's out fishing, they would all come back with their owl eyes, and so they were all sending in pictures with their different tans that they had. So it was different, but it was a good different as well, because you can't always get to each of the communities. So at least you could see it on Facebook, all of the singing and the dancing. Yeah. You
call it owl eyes?
Yeah, well, yeah, from the sunglasses, yeah.
So it's the Inuit version of a t-shirt tan.
That's right.
I'll have to remember that one. Yeah, I've seen some good and bad with this situation. Is that certainly families have benefited and that they have a lot more togetherness. The schools have suffered, the professionals have suffered, but there's been a lot more land-based activity, which is good. So it's, you know, it's a mixed bag sometimes, and depends on your willingness and ability to adapt.
Mm-hmm. And I also wanted to say quickly, like, we had to get really creative when it came to harm reduction. in terms of still being able to provide that service. So we had to like basically shift where our like clients who would receive methadone, we bring that back into community instead of, because no one, when this first went down, no one was allowed in or out of Eskizoni. Everything was partitioned off and blocked by security guards, and you only were allowed in with pass and permission and approval. So it was really important to us that we would be able to still maintain at least safe harm reduction practices for those clients. And bringing that to community has been a huge help for people, in addition to providing access to safe kits as well, and allowing them to do that in a social distance manner has been extremely helpful for those clients struggling with addictions as well.
Okay. What about you, Cliff? What's Sturgeon Lake's response to the harm reduction issues and the kind of, you know, pre-existing social issues?
Well, I haven't heard too much because I was away for a little bit during it, but I think because we do have a methadone program that we were still running. And so a lot of it was just practicing that social distancing, not having too many people come on because they have to do like daily. So it's doing more trips and, you know, things like that. But yeah, there hasn't really been a lot of programming in terms of, you know, because of what's been happening, but there's been a lot of like preparation, like with our community hall. Now it holds all of our canned foods and all those type of goods. And so it's more of like preparation if there is going to be a second wave. So I think for us, it's just basically making sure that everybody, you know, is kind of prepared for it, but also, you know, just working with the other staff to like with like home health care and, you know, the nurses, and making sure everybody's kind of, you know, working together and knows what's happening on. Like, we started doing like weekly meetings. So just so everybody's prepared. So it's more preparation than anything.
Okay. What about Peggy? What is your community experience in terms of self-harm and pre-existing social issues?
We have Inuvik is kind of like the hub of the Beaufort Delta, and so we've got a lot of homeless situations. We have two homeless shelters. One is the warming shelter. It's where you can be drinking and then you can go and sleep. You'll have somewhere warm and safe to sleep. And the homeless shelter, which is you have to be sober to stay there, and you have to abide by these rules where you can't be drinking or drugging. And so with the warming shelter, they were having there. It's almost like a big, just open space where they would put mats down and let the guys or women sleep. And so they had a big issue with the social distancing. So it worked out that, of course, the schools were all shut down and the college as well. So the GWT graciously offered the warming shelter that space. So the college has apartments that they rent out to the students. So they're 1-bedroom apartments. So each of the clients got their own bedroom. I don't know how it's going to be when they get back. End of this month, they're moving back to the warming shelter because school will be starting soon. So we worked really closely with the GWT, the government of the Northwest Territories, the Housing Corporation, all of the different organizations here in Inuvik. And so we have the warming shelter, and so they also had to keep them in one space, self-isolating. They offered the alcohol and tobacco as well. They get so much per day. And I think it was working out pretty good. So I don't know how it's going to be when they move back into their regular space into this month.
For sure, we've adapted to new realities. it's been a kind of a mixed bag in Mistissini and some of the Cree communities here. There's just varying degrees of isolation of communities, but Mistissini is very close to Chibougamau, which is a major town. There is a problem with bootlegging in all the communities. Our communities are dry, but there's a certain level of alcohol that's always present. So some individuals use that as an opportunity to exploit others by charging exorbitant amounts for alcohol. So people have shifted from beer to hard liquor, and that's been very difficult for younger, inexperienced drinkers. There's also been issues with the drugs coming into communities, a much higher volume, I think. But at the same time, I work in a public health office, and we have a very good team of people who know the communities very well and work very closely with all the communities. We have many Crees who work in our organization as well. And so they know the realities of community life, and that's helped us to sort of, adapt our strategies. And the other one of the benefits to this situation is it's actually led to a lot of much higher level communication between the entities. We have the Cree Health Board, we have the Cree Nation government, we have the EU police force and justice. So there's been a lot of conversation that's happened at that level. And, the communities, they get their advice from the public health office, and they can either settle for that advice or they can take it to another level. And most communities take it to another level because they're very focused on keeping their communities healthy because of the vulnerability, the health vulnerabilities of the population. But in spite of that, we've still managed to deliver certain levels of service and kept the population safe. So that's the main thing for us. It's been helpful. Of all the innovations that you've implemented in your communities, which ones do you feel are being the most successful? Maybe start with Haley.
Yeah, I would say that our telehealth appointments have been pretty successful. Granted, there are people that haven't had access to like cell phone, Wi-Fi and things of that nature. So trying to provide them an opportunity to have access to a phone through our crisis and referral center has also been helpful. I also think our actual online programming by our youth space was really helpful too, just keeping everyone engaged and connected. And overall, like Cliff said, our number of referrals definitely went down. And I just think hopefully now that the precautions are starting to ease up a little bit, that we can start re-engaging in either not face-to-face, but a social distancing type of manner to kind of get things back on track. So yeah, I would say just also, like you said, the amount of communication has definitely increased. We were doing weekly meetings when it was at its most severe, and we were getting a lot of insight from like banding council, provincial officials, government officials. Public health was a huge help in providing training, as well as our community health nurses who were out and extremely visible, like on our local TV channels, providing like hand washing songs and Mi'kmaq and all of that kind of stuff, just to try and keep people connected and aware of kind of the severity of the situation and what was going on, what is going on. So yeah.
What about Sturgeon Lake, Cliff? What's the innovation that you think has been probably most successful? We can't hear you.
Sorry about that. For us, I think because we have a radio station, we've been doing a lot more teaching through that, with a lot of like language stuff and a lot of other health things, and hosting different contests, and just trying to for the most part, we're trying to let the community know that we are here. We do have services, but I think because the way we are set up, it didn't really like in terms of innovation, I think where we could probably increase, and something we've been starting to talk about more now, is doing more of the online counseling. And what does that look like? But I think there hasn't really been much like innovation in our community in that aspect, though. Of what can we do more? I think it's more of just trying to figure out how we can engage young people within the youth space that we have.
Okay. And Peggy, what about your region? What's the innovation that's probably been most successful?
The most successful would be on the land. Just being, like I said, they're with their families, their own social bubbles. Our challenge right now is to go out on the land as a group, because we can have up to 50 people outside, but you can't be in the same vehicle without your own social bubble, your own family. So we've been working with the other organizations, and they have a bus. So we got the okay to use the bus as long as everybody is wearing face masks. So I think we've got it worked out so we can be out on the land for the summer. Our berry picking season is coming up pretty quick, so everybody is gung-ho to be out probably every day out on the land.
Yeah. Yeah, I think it's a similar situation in Mistissini. People using the land a lot more, going off in the bush. We have a nice big lake here, Lake Mistissini. It's actually the largest freshwater lake in Quebec, and so there's a lot more activity in the water. Hopefully people are being water safe, but Crees are very, very adept at using the lake. And yeah, just people going off to their camps, spending more time with their families. So that's probably the main thing is people, we have been running the telehealth since the beginning. When we first started, it was kind of a free-for-all, and they went back to a scheduled approach, and that seems to be working better. And it's the sort of same rate of people showing up or not showing up as online. But there are different challenges, at least talking to the therapists, is that they don't, there are technical challenges that make the encounter different, but probably not any less effective. So it's just the main thing about advertising and making sure that people know that the service is here and to make use of it. There are other challenges associated with that in terms of people having access to Wi-Fi, having access to the technology, or even having a private space. A lot of times what people do is they'll take their cell phone and drive somewhere or go somewhere quiet and try to interact with a therapist that way. In terms of innovations for our community, I think the situation has spawned a lot of activity and you know, putting together projects that we're working. We created a psychosocial hotline and just a lot more communication between services and professionals, you know, because we need to it's kind of had that sort of whipping us into shape very quickly situation. So I guess we're getting near the end here. I just wanted to ask if there's any sort of takeaways or lessons that you wanted to talk about, you know, good or bad or whatever it could be. Maybe Haley?
Some takeaways for us were, we realized that we needed a better assessment tool for suicide over the phone, and coming up with a program or a protocol that could be implemented, just because we couldn't either see the person that we're working with, or technological issues where we can't get consistent communication. So working with the RCMP and things like that was definitely helpful, but it took us a while to kind of get there to make sure that we were supporting our clients to the best of our ability. Transportation and logistics were a huge issue because we were so locked down, especially in the thick of all of this. And just getting better communication around that, because at one point when testing was at its highest, we had a COVID van that would go around and pick people up and take them to the hospital to get tested. But then there became some stigma around, oh my God, the COVID van's at the house next door. So like people would start to get upset about that. So we had to kind of come up with different means to get people tested without A, breaking confidentiality, and B, the stigma around, oh, that house had the COVID van over there kind of thing. So that was a lesson that we needed to learn. And the, like I talked about earlier, the harm reduction program and understanding that clients still needed access to those things, whether, like alcohol and tobacco and such. That was really important, and we eventually got to a great plan and support from Chief and Council to get those supplies into the community. We also had some kind of ups and downs. We put a pause on access in terms of collecting more consent. So we did that for about a month because people were, it wasn't hitting when we were asking people to take part in the research. So we decided to put it on a pause until we worked with central office to come up with a fillable form. And I guess once the tension died down a little bit, more people were willing to take part in the research again. So there were definitely some kind of ups and downs, but we eventually figured it out, and we're still learning. Like Cliff said, we're basically preparing for the next wave to the best of our ability. And communication seems to be the biggest key because it just mitigates so much anxiety, especially for all these kids who are watching this on the news or hearing their parents talk about it. So providing resources for them that are age appropriate and culturally appropriate was really important for us to make sure that we did that. So.
Okay. What about you, Cliff? What are the short takeaways that you want to add here?
Well, I guess one thing that I want to talk about in terms of like the impact kind of COVID has had in terms of the work we're doing with access is like, you know, how do you start having, like, before COVID happened, we started talking about with different people around sustainability because we are running out soon. And so when COVID happened, a lot of those conversations kind of got lost within the whole chaos of what was happening around COVID. Now it's kind of like, it's kind of, I guess, for me, challenging to figure out, okay, how do we regroup? How do we restructure access to fit what's happening now? Because it's now moving forward, it's going to look different in terms of how we do our work, but also how we get sustainable funding, you know, for another 5 years or how many years, wherever, how much we're looking for. So I guess it's just challenging to have conversation post-COVID around getting more funding. And then that's just kind of where I'm at with the project right now, is that I'm starting to re-engage with people that I was engaging with in other organizations of like, you know, how do we still show our value, and how do we still, like, this is our plan, even with the whole COVID situation happening, to prove that the work that we're doing is actually still making a difference.
Yeah.
So it's kind of just adapting to that kind of new experience.
Okay. What about you, Peggy? What's your sort of takeaway here?
The biggest challenge we have right now is our elders. They're in lockdown. The long-term care is shut down, where nobody can go in or out unless you have your full PPE. And so we have a lot of elders that are in the long-term care, and community members, their family can't go and visit them. So it's been a real challenge to try and figure out how we can get the government to say, okay, open it up for the family so that the family can go in and see. So they had a big meeting, and the hospital was letting the elders go out and meet with the family outside because it's warmer now. But now they ended up having a chicken pox scare, so it's shut down right now again. So we're really waiting for phase 3 so that our elders can take part in our programs again, and family can go in and see them. That's a really big challenge right now. And with the youth as well, we get a lot of feedback from like say 30 to 50, that age group. They're really vocal and can go online and let us know or give us a call. But it's our elders that are suffering. They're in real isolation. If they don't have family members looking after them, it's kind of hard for them to even pick up the phone to call someone. And our youth as well, we were just talking about them yesterday. They're not vocal as well. We don't really know what they want or what they need. So right now they're working on doing picnics down at the park just in Inuvik here to get them engaged and ask them, what do you need? What do you want? So hopefully in the next couple months we'll have an idea, and we're looking at how to engage with our elders and our youth. So if you have any ideas, throw it our way.
Will do. I think for Mistissini, I think one of the main challenges that we're experiencing right now, and it's like the same sort of issues that everyone else is having. Funding-wise, we're okay. That might change. But right now, it's just trying to deal with the uncertainty, and then also a certain level of frustration, because our region is its own health region. We're each region 18 within Quebec, and the Crees have jurisdiction over this area, this whole area of northern Quebec. But we have neighboring health regions, and each of them are operating on different timelines in terms of reopening. And so what's happening now is we have a lot of people from the south who are coming up here. They want to go to their cottages, they want to go camping, they want to go fishing on the lakes. And of course, they're coming up with their RVs and going into local places. You know, there's interaction between the community members and these people from the south. But then our own region, we can't go down south or else we have to self-isolate for 2 weeks upon returning. So there's this kind of frustration over the kind of disconnect between health regions. But it's probably just dealing with the uncertainty. I think we're ready for the second wave when that hits. It's not a question of if, it's going to be a matter of when, and just sort of getting ready for that as well. So I think we're pretty much at the end of our discussion here. So I wanted to turn our attention to some of the questions. So maybe if you can just go in order of, or if you really want to do a question, just put your hand up. The first question that I have is, did you observe some aggravation regarding isolation, distress feelings, or drug consumption within the population or among workers? So Haley, maybe you want to tackle that first?
Yeah, we definitely got some pushback that community members weren't able to leave in order to get those types of resources like tobacco and alcohol and such. So that's why we had to come up with a new solution for people to access these substances to maintain proper harm reduction. So yeah, we definitely got pushback.
Okay. What about Cliff? Did you get issues of aggravation, levels of stress in the population?
Yeah, there has been a lot of stress around that in talking with the pandemic coordinator, but there was some kind of like pushback of having our community blocked off. But a lot of it came from people that were not actually from the community or not actually members of the community. So, but I think for the most part, it's just around like the drinking and the drug part. But then there's really nothing that we kind of can do for that part. It's more of just observation. So it's kind of a little bit hard to kind of tackle it because they're more focused on like making sure that everybody, doesn't have it, and if they have it, and just doing the whole plan around that. But yeah, there's just a little pushback for more non-community members than there were community members. Because we live in a community that's not too far from the city, so it's more a question of like, when is curfew and what does that mean during like if we pass that time? But we can't really prevent a community member from not coming into community, even if it's like after curfew.
Okay. And Peggy, what about you? Have you been dealing with issues of isolation and distress, increased drug use consumption?
My husband just came home yesterday afternoon, and he was like, what is going on? He just went to the bank, and he said there was like 10, 15 people hanging around downtown, but it's finally warming up. So there is an increase in alcohol and drug use for sure. And I believe it's just everybody is so lonely. They're sitting at home where they had to isolate or be on their own before they went into phase 1, because everybody was on lockdown. You had to stay home and not be anywhere, and you couldn't even have anybody that's not in your household in your house. So it was a real big impact, because we as Inuvialuit, we're community driven. We like to be around our community, and not only our close family, we have close friends and community members. So it was a really tough time for our people to isolate. And we're so huggy. We always want to hug everybody, and they had anxiety over that. I still have anxiety over that. I always want to give everybody a hug. And so there is, I don't know if any of the other communities as well, or provinces with the CERB, we've seen there's more money in people's hands. So of course they're going to have more money for drinking and drugs. So we've seen an increase in that. I don't know how it is for the other communities.
Yeah, I don't know for sure. I can't really answer that, but I think there is probably more drinking, drug use in our regions. But like I say, at the beginning, for us it's kind of seasonal. So the summertime is usually the time when there's often a lot of social issues that happen in the community, especially among the youth. But we're dealing with it. That's all we can say. Isolation, yes, everyone's feeling it. So, but if everyone's feeling it, then it kind of makes it a little bit easier. Yeah, so it's probably the same situation as with everyone else. We did have a question about testing for COVID-19 in your communities. How has the testing been? Like, are you able to access actual testing? Haley?
So we are testing in community. They have the testing stations set up in Sydney. So anytime anybody was suspected or thought they needed to be tested, they would contact our community health nurses, and then we would figure out the logistics to get them there, whether they transport themselves or whether we would provide transportation for them. So we did have access to testing here, and the community did a great job of identifying like who was on quarantine, who was like coming back to community from being on vacation, and all of that type of stuff. And they did great contact trace like mapping to ensure that everybody maintained the quarantine. And if they needed the test, we would figure it out how to make that happen.
What about in Sturgeon Lake, Cliff? What's the testing like?
Yeah, so about a month and a half ago, we started doing weekly testing. So we have it available every Monday now. And then staff are also to kind of get their a little like we have to go 2 days, or we have to go into the office to kind of do these like swabs and stuff like that every day, just to make sure that, you know, that all the staff members are, you know, well, and if it's sick, has to stay away for at least 2 days. So whether that's cough or a cold or something like that. So just being really cautious around that part of it.
Okay. And what about up in your area, Peggy? The testing is pretty good?
Yep, we have testing here in Inuvik. Our hospital is the regional hospital, and Inuvik is one of the spots where if they're flying to or driving back to their communities out of Inuvik in the Beaufort Delta, they would have to self-quarantine for 2 weeks here in Inuvik. And we're using the local hotel. So they're quarantined to the hotel and they can't go into the community until they're done their quarantine. And yeah, we do have the public health nurses. We're open, aren't still open, and can do testing. And if there's if a patient suspects they may have COVID, they won't bring them into the hospital, but they would actually go to their home to do the testing.
Yeah, it's probably the one area in our region that's been extremely good is the testing. We're testing people constantly. It took a little while to ramp it up, but we actually had about 10 cases of COVID in our region. They happened early on. And our region was actually one of the first areas, it was actually the first area in Canada that imposed mandatory self-isolation for 14 days. And then other regions started doing the same thing. But our public health director was very, very on top of things from early on. She knew what was coming. And so that team really put things together, and the testing was one of the things that came into place very early on. So we've never had a problem with testing. Maybe this is a bit of a side, but I'm interested in this question. But I know that they can do antibody tests to determine if the virus is actually present in the population. And I was just reading a thing today about they did a antibody testing in part of New York City, I think, called a neighborhood called Corona. And they found that about 63% of the population had actually been exposed to the virus already. And this is a working class neighborhood. So I would be interested to know if there's any evidence that the virus was actually present in our communities. My sense is that it probably was so, but it just never got a chance to spread, but it's hard to say. So that's something I would be interested to see what happens. We have a couple more specific questions. One for Cliff. Says, do you think the youth space having to be shut down has caused more mental health problems for you, even if you're getting less referrals? So what kind of impact is it having as that shut down the youth space?
Yeah, like I believe it has had kind of a more of a negative impact on young people working with the other youth coordinators. They have been getting like inboxes from youth saying when it's going to open up, and some of them feeling isolated and feeling that they're kind of disconnected in that sense, because a lot of the youth that we've seen, we probably in a month we would probably average about 200, 250 youth coming in and out of the youth space a month. So that kind of has, I feel like that's kind of had an effect on our regulars and just in general in terms of like the engagement that we were doing, because we're hosting a lot of events kind of. So there was that, you know, loss of connection. And now it's just kind of like, you know, how do we keep up engagement? But I think a lot of it is just doing little check-ins here and there with them and telling them that, yes, we are going to be opening up services, that we are going to be starting to do more youth engagement and things that they want to see in the community. But yeah, ultimately, yeah, there has been a negative effect on, you know, the young people's mental health throughout this.
Okay. And we had a specific question for myself and Haley. Says you mentioned that there have been more communication between organizations and communities during COVID-19. Has this ever happened before because of past events and challenges? I guess it's more of a retrospective question, like, you know, have we? Yeah. So what about you know, how did this happen before?
Well, for us, I mean, I've never dealt with anything like this before. And in the community, I know we've been getting support from like the federal government and ISK and organizations like that, but this felt different in the sense that there was constant communication every day. Council was meeting with the emergency management team. Our directors were constantly reaching out to us on a daily basis, doing all staff Zoom meetings so that we could all be in the loop of kind of what was going on. So I don't think anything has been to this level in the past in terms of communication.
Okay. In the case of Mistissini and Iuishi Cree region, we had a very recent experience with H1N1 back in 2008 when I first started working up here. And so in some ways the communities were ready for the COVID-19 because of that past experience with H1N1. And they actually did have quite a few cases. And unfortunately, some of the cases that happened in our region broke out in people's camps is because somebody came in who was infected and they infected other people in the camps. And it caused quite a bit of sickness. I don't think anyone actually died from that experience. But the other interesting thing that has happened among some of the elders, I was told that some families, some older people started talking about experiences with TB that they knew about or had experienced. And there were some stories that people had never heard in the family about, you know, the people being taken away from the communities. And, you know, they didn't really realize that somebody's relative had passed away down south. So it's actually provoked these conversations within families about past experiences with infectious diseases. And so I think there's a kind of an underlying readiness in the population for infectious diseases, because in our region, at least, there's a very strong memory in the population of what things were like in the past, TB, different gastrointestinal outbreaks and stuff like that. So these are fairly recent. You know, there's still a lot of people alive today who have clear memories about those times. So I think it sort of put people on their guard in a very positive way. And so they're willing to accept the kind of hardships of these measures that are in place now. So we have quite a few other questions. Maybe I'll just find one and I'll see what you think. We have a question. Did you have cases of youth that found it hard to spend more time with their family, or youth that don't have a carer or a family member that they go to? So maybe Peggy, why don't you try that question?
I don't really deal with the youth, so I wouldn't, I can't really answer that. But we just had our mental health awareness working group. We meet once a month, and we finally got to meet yesterday. And we had the youth counselor there that works at the our local hospital, and she said not only that it's summertime, it's hard to connect with the youth because the youth center is shut down as well, and the school is shut down. So they're trying to figure out ways to really connect with the youth over the summer. So it's still a work in progress, and I know that they're suffering. I have my granddaughter who is 16 here with me, and she finds it hard to be in isolation as well.
What about you, Peggy? I mean, Haley?
I definitely think there has been families that have complicated, it's been complicated with them being stuck at home. And I mean, we've been unable to meet in large groups until recently. And once the kind of precautions eased up, like even things like celebrating big milestones or celebrating the passing of a loved one, they weren't able to gather to do those type of things. So I think there was a lot of challenges there around surrounding that for a lot of people.
Yeah, we had a similar situation with us in our region. I think for many families it's been okay. You know, there's families that have spent time together, but I think if families were distressed before the pandemic in many ways just made things worse. We had some very unfortunate situations where some youth were in under youth protection, and they were in a closed facility, and they couldn't leave. And I think they found that really hard. I know that some of our clinicians were working with those youth that were stuck in an institutional setting, and had to, you know, do their best to give them whatever comfort and support they could to get through that time. I think things have improved quite a bit since that time. But again, I think it really depends upon the family. You know, sometimes families come together, and sometimes these situations can make things worse. And of course, some people have access to a camp where they can go and be on the land, and not everyone does. So it's kind of a mixed bag in a lot of ways. I did have another question that I thought was interesting, and it's more a question about the impact of COVID and the shutdown on actual workers and staff. Like, did you have experiences with workers feeling powerless or, you know, unable to function? Maybe we start with Cliff on this one.
I guess even for myself, like, because when COVID happened, because I'm on contract, I didn't really have a kind of a space, I guess, because we kind of shut down the offices and things like that. So I was kind of in the weight of like, okay, am I still part of this? Am I still, like, what should I be doing? And yeah, I guess for myself, there was a lot of that sense of I didn't necessarily have control. I didn't feel powered, you know. But then I guess talking with other community members, a lot of them were like, you know, how do, now that this is, they, you know, go on serve and, you know, some of the other different funding, but it's more, yeah, I guess there's been a lot of kind of stress around that part of it. But I don't know.
What about you, Peggy? Did you have experiences, issues with workers feeling powerless or frustrated, or just, you know, how did they cope?
I know with the like for myself, I was even more busy than when I was actually at work because we were dealing with the on the land funds and setting up all of the paperwork for that, for the charge accounts and getting the names and how many people, and we were running ragged. We were like 12, 14-hour days getting everybody out on the land. And so I was busy, my team was busy. And there was other like different parts of our organization that couldn't really do anything. So they were like stir crazy, bored. They had to come up with like projects that they can work on from home. because we were shut down from our building. We couldn't come into work. And there was, but now we're back at our office full time. And it's still pretty quiet because the community is still basically can't really do anything until we get the okay from the GNWT to do different programs. So it's still quiet, but it's a learning curve. Huh? I think it's a learning curve for everybody.
And what about you, Haley? Is it what's been the situation among the workers?
Our team, so around the beginning of March, or middle of March, when they first started or ramping up everything and everyone got sent home, there were a lot of our team members that wanted to be in the office but couldn't because we weren't allowed, and that caused a lot of frustration because with therapy, sometimes it's more powerful to be in the room, and it's not as easy to do telehealth appointments with some of the clients. So clinicians definitely felt kind of disconnected there. But also on the other side of that, with the telehealth appointments going on, a lot of our team members would say things like, you don't realize how exhausting telehealth appointments are because you can't actually see sometimes like the kind of body language, or there's more silence in an appointment because there's no connection, or there is the disconnect of the phone or the computer. So they would be doing their normal amount, 4, 5, 6 appointments in a day, and by the end of the day, they were just like, I'm so exhausted, I didn't even realize that doing this over the phone would be even more exhausting than in person. So that was definitely a comment. We also had a lot of people switching around their roles. So like our youth crew, because the youth space was shut down, they transitioned into supporting the health center in cleaning and disinfecting and like crowd control within the building. And people's roles just changed, and some people like that, and some people wanted to go back to their old roles and positions as well. But I think for the most part, we were still lucky enough to be able to do our jobs. And the transition back to work, I know that we were definitely anxious, but now that we're here, it seems to be.
Yeah, it was kind of a similar experience for us. Very early on in the pandemic, we had a lot of planning and work to get done, and the public health team basically sort of sucked all the employees that they could into the work that they were doing. But of course, there's not enough work for everybody. So some of us were really, really busy, and but we got things into place. And then others were less busy than some of us. As the sort of work was in place, they didn't need us as much. And I did notice that some of my colleagues who were not recruited into that work were kind of resentful. And it just by happenstance that I was looking at, I think the Mental Health Commission's website, and they were talking about the kind of psychological effects of the pandemic and disasters on people. And one of them is actually a sense of resentment that can sometimes crop up among some people, and it's because they're not being involved in the actions. And I did notice that among some of my colleagues as well, and I pointed out to our managers that there's a level of resentment that's occurring among some of my colleagues, and even some of our managers who felt that they were being excluded from the work. For me, I kind of analogized it, in the early phases of the pandemic, everyone was rushing off to the frontier to secure the borders, but then we forgot about the people back at home. And so I think in the last couple of months that focus has gone back to the needs of the community and making sure that they feel supported and everyone's got a job to do. Some days for myself, I'm not very busy and I really struggle through the day, and then other days I manage to motivate myself and I have lots to do. But it's sort of that's how it is. I think I learned to sort of roll with it now and just accept that there are days that are busy and days that aren't busy, and you gotta just keep at it. But yeah, I would say that resentment was an issue in the very early phases of the pandemic, because it's a kind of a natural response. People want to feel empowered, people want to feel included, and sometimes there isn't enough work for everyone in certain phases of a situation. So we have a bunch more questions.
Greg, I do have to head out.
Okay.
Yeah.
We're gonna lose you.
Yeah, I thought we were only on for an hour.
Yeah, I guess we're winding down now.
Okay.
All right.
Yeah,
Thank you very much for joining us.
Yeah, it was great to chat with everybody, and we'll chat again. Alrighty.
All right. Take care, Cliff.
All right. Bye.
Bye-bye. What about Haley and Peggy? You still have stuff to contribute here?
Sure.
Want to take a few more questions?
Yeah.
Yeah.
Okay. I'm trying to find some more good ones. I think we got most of them, actually. Okay, I'll take this one that came in earlier. How is social distancing, like several hand washing every day, being integrated into community practice? And have the community thought about using culturally based methods to promote and integrate practices? And could these be implemented in your youth clinical services? So what are the kind of cultural practices that you've used to address the kind of safety measures? Peggy?
I don't know. We don't have any cultural practices regarding hand washing or anything, but what we do, what we're enforcing right now is the social distancing. We have signs if we're going to go out on the land. We have signs where you can go and we'll actually take basins with us to go to the out on the land when we do any berry picking or day trips, and a lot of hand sanitizer as well.
Okay. What about in Mistissini?
In Mistissini, one of our nurse practitioners, Dana Silboy, he actually came up with a youth Mi'kmaq version of how to wash your hands, and it went viral, and it's a great video you can check out on our Facebook page and things like that, which was awesome. We also did a lot of videos from our clinicians, and some of the ones that were most powerful were from our elders. Clark Paul, he did basically a shorter version of the kind of 7 sacred teachings and kind of what smudging means, and people felt like that was a fabulous way for him to kind of share his knowledge. So people found that helpful. And then here at the youth space, we had all of our community health nurses train the staff on proper hand washing and proper application of PPEs. So the youth space was implementing like hand washing before activities, like during activities and after activities. And then once the building kind of shut down, we all, when we came back, just maintained that. So we all hand sanitize, we wear masks within the building if we're not in our own offices. And yeah, I don't know how much more cultural stuff, but that's basically what we did to try and kind of keep it realistic.
Yeah, I would say it's the same thing for Mistissini. We did do some strategies to encourage hand washing and staying safe. I think we modified the social distancing by using a goose or what was it, snowshoes or something to demonstrate the distance between people that you should keep. We did provide videos about hand washing and singing happy birthday. And then any of the cultural activities associated, like going for snowshoe walks. We made the messaging particular to Cree communities. And it's the same thing now, is just sort of, adapting every kind of new measure to the realities of our community life. I think the main thing that I've seen is that the use of technology, we've made, used the social media to, the best advantages that we could to ensure that there's good communication out there. So yeah, I would say that, we, used everything that was in front of us to make the best of a very difficult situation. So I think that's about it in terms of questions. There's probably a couple more that I think they've been covered through the course of the conversation here. So maybe we could start winding down. Is there anything else you want to add? Any other last comments, messages of hope that you want to give to people? Any kind of salutations? Maybe Peggy?
I just want to say, I'm just reading this poster that I have from of when the Inuvialuit almost got wiped out due to a flu epidemic. And it says, we can never return to the world of our ancestors as it was. However, the spirit of our ancestors remain with us. This spirit is a great source of strength to our people. And I always instill that it is in us. Our ancestors lived through us. We were born from them. That's who we came from. And they were strong and resilient. And we can get through this together.
Yeah, for sure.
And I was thinking about what Peggy said, that we're strong and we're resilient, and we all want the best out of this situation. So like, wear your mask, be a good citizen, and let's just hope for the best and keep doing all the hard work to keep our loved ones and community members safe.
Yeah, I feel the same way, not grounded in any kind of cultural belief about this, but, well, maybe so. But yeah, we are all very resilient. If we weren't, then we would have died out as human population many generations ago. That we have a lot of inner strength. And I think that sometimes we forget that. I think our lives have become very comfortable, and we think if we lose like one of those comforts, then the world's going to end. It's not the case. Our ancestors lived through very difficult times. They survived epidemics that were even much more severe, and we're still here. So I think we have to remember that, and remember that our ancestors went through a lot to get us to this place, and we need to go through a lot right now to get that next generation to another place. So just got to keep going forward and staying positive and supporting one another. That's probably the most important, is that we are resilient. So I think that's about it. I don't know how much more I can squeeze out of you too, but I want to thank you for your participation. I think it's been a good conversation, and I appreciate your contributions as well as Cliff's. And I guess we will conclude the webinar at this point.
Thank you
very much.
Thank you.
Bye.